talk about. One is seasonal allergies and asthma flare-ups. Second, I want to talk about is eczema or itching or skin rashes. And because we're seeing more of these over the last week or so. And the third is, for some reason, I've had a lot of people with joint pains. But I think if someone has a question about joint pains or aches and pains, I'll talk about that. But I'm going to try to talk more about allergy and skin issues, where you're thinking it might be allergies and where you're thinking it might be your eczema or other rashes. I had some interesting cases where it was not easy to figure out what could have happened. But nonetheless, it made me think more about how frequently we're beginning to see these things and issues suddenly because the weather has changed. And still we're in April, still a little cold, but we're already beginning to see a lot of pollen activity, and that is leading to a lot of people having flare-ups of their asthma and any and just allergies. So a lot of it is pretty simple to treat, but again, it's difficult to put myself in my patient's shoes if I'm not personally suffering from allergies like they are, and it is pretty debilitating. So we'll jump straight into seasonal allergies. First of all, some people are more prone to allergies than the others. So obviously some people suffer a lot more than the others. So we need to be more considerate of the people who are dealing with this. It's a terrible time of the year for them. So the simpler version of this is what we see is stuffy nose. They're walking around with nasal congestion like this, and is just, it's not fun for more than a day or two when we get sick. But if it's like a day in and day out, it makes them miserable. An even simpler version of that is sneezing a lot. Like you're just sneezing and more frequently, but that's still on the milder side. And then you have your nasal congestion. That's bothersome. And then what gets worse is when your eyes are starting to deal with these allergies, what we call allergic conjunctivitis. So the eyes are burning, eyes are hurting, and you have a lot of tearing in the eyes, and you just can't. You're having difficulty seeing clearly. You're constantly having to rub your eyes because they're very itchy, and that leads to a whole new issue where they're rubbing their eyes so much that they're causing a rash on their eyelids. So we see that. And the third thing that'll happen is people will start having some cough, and well, it's usually a dry cough, but that comes from what we call postnasal drip, stuffy nose or runny nose. And if the nose is running, basically trickles down this way, it also trickles down back towards your throat, and that causes it this kind of feeling, and you're constantly either coughing or clearing your throat. That just makes everything harder. Now imagine doing this all day in and out. But the next level is some people will go one step further, and they'll develop what we call seasonal asthma. Seasonal asthma. Now, asthma comes in many different variants, and one of the common ones is seasonal asthma, where as soon as the springtime comes, pollen activity is high, pollen count is high, they will develop asthma. Now, asthma is like not only is nose congested, but when you're able to breathe through your mouth, you still can't breathe in. It's just a lot of inflammation in the lungs itself. And now you're feeling short of breath, you're coughing, this is just completely takes you out of work. You can't go to work, you can't even do your daily tasks. And, we're beginning to see a lot of those people too. So obviously, when we are at this point, what are we going to do? What should we do? And how to identify if your allergies are rather simple, or, one is how much they bother you, and the other is how much do they bother your doctor. So so most obviously, when I see these patients, the first thing I do is I'm listening to their story, but first thing I want to do is listen to their lungs to see if they're wheezing and if they're having an asthma attack. Surprisingly, a lot of people don't realize that. They just will feel that they just don't feel well, they don't feel right, and they had some cough a couple of days ago, but now they're not coughing much. But when I ask more, they haven't gone to work, they're not moving around much, they're just sitting put, and obviously not going outside. So if you're not going outside, you're really, your physical activity is on the lower end, and then they feel that they're better, but when you listen to their lungs, they're wheezing away, and which is why they're not moving, and then they still decided to actually come to the doctor because something's not right. So yeah, when I listen to the lungs, if they're clear, I rank them as mild to moderate. But if it's a flare-up of asthma, or and sometimes I hear patients tell me that I don't have asthma and I have never had asthma. What are you talking about? So when I hear that, sometimes I clarify. Either I can say it's seasonal asthma, and I say, but I've been here for 5 years and I have never had this before. Okay, so this might be allergies with what we call bronchospasm. The thing that causes you to wheeze is bronchospasm, in at least when we're talking about allergies and asthma. So just to be clear, if you're wheezing and you may never have had asthma, but your body's reacting to the allergens, which might be pollen, tree pollen, grass pollen, many different kinds, and then you start wheezing, and then you basically, trying to breathe underwater, could get that bad. A lot of people actually experienced some of that with COVID, although I won't say it's that terrible, but nonetheless, people had a lot of bronchospasm at that time as well. So just to keep that in mind. So now, what happens when you go out? And what can you do about it? One is identify that if every year you have allergies and you start getting bothered by this, first and foremost, the simplest way to solve this problem is, as soon as you go out, wear a mask, an N95 mask or a KN95. That's those made in China ones that became popular during COVID. So I'm sure everybody has a lot of them left over at home, or you can buy them anywhere you want. But an N95 mask, it basically creates a seal around your face, and the pollen doesn't get in. You don't breathe it in, or you don't breathe too much of it, and your body doesn't react to it. It is that simple. And before COVID, when I used to tell patients, they would look at me as if I was crazy, because yes, it's a great idea, but who's going to walk around wearing a mask? Fortunately, now anyone can walk around with a mask at any time, and it's respected. Nobody thinks you're crazy. People think that you're being extra cautious. So it only makes other people think maybe they should also wear a mask. But wearing a mask will alleviate 80% of your problems. It won't protect your eyes, but at least you won't be sneezing and wheezing all day and night, and nasal congestion will also be better. So that's pretty simple. If you can do this, believe me, you will do great. What about the eyes? For the eyes, you want to prevent exposure as much as you can, but there are eye drops available over the counter. There are plenty of allergy eye drops. You don't want, I'm not going to name which ones, but there are plenty of those over the counter. You can buy them and use them for allergies. What you don't want is those clear eyes or redness removers, and those are not the ones that you need. You need the other ones that are for allergy and itch relief. But I don't know if I can give you the names of that on the air or not, but it's over the counter. Um, and then same thing for nasal congestion. It used to be prescription, but now these nasal steroids drops are available over the counter. I'm just going to say the Flonase and Nasacort, they are available over the counter. They can be used relatively safely. Check with your doctor if you have any doubts, but they are they can be used for nasal congestion. And the medications for, but you're still having allergy symptoms, and there are plenty of allergy medications out there. Uh, there's Zyrtec, there's Claritin, Allegra. You want to avoid the Allegra D, Claritin D. They come with the decongestant, so this is an additional medication. But I would rather avoid them and go to the source. Basically, a systemic that you take in. It reduces your body's immune response to the allergens. And for the eyes, you use the eye drops, and for the nose, you use nasal steroids. What you do not want to use is Afrin. Afrin is a brand name, so there might be different kinds of medicines, but most commonly for nasal congestion relief, Afrin is what you want to avoid. Why? It's almost like sugar. It works very well. It will make you feel better rather quickly, but the congestion is going to come back because it doesn't last for too long. The nasal congestion is going to come back, and if you're using it too frequently, what you develop is a dependence on this medicine. And now, even if you don't have any exposure to any allergens, you will still have this nasal congestion, and people will be dealing with this whether there's allergy season or not, and yet you'll be stuck with using that spray forever. So when can you use it? Why is it still, even then, if it's not good for you, why is it available over the counter? Well, a lot of things are available over the counter. They're available over the counter is that if you know what you're doing, or if this is appropriate or is being advised, you could take it because the side effects potential is lower, except for this one, because this causes what we call rhinitis medicamentosa. Basically, the nasal congestion secondary to a medication. Simply, if you're going to use it and you're very miserable and you have a presentation or a test in the morning or something, you can use it for a day, at most two. Don't overdo it, because I've had patients who've been dealing with this, and then they end up going to ENTs, getting allergy tests and 50 different things, while all they had to do is stop using this and then deal with the rebound congestion for some time, and then you're good. So what can you use is Flonase, Nasacort, or any other similar nasal corticosteroids. Your doctor can advise you on if one is better than the other, but they're relatively the same. Most of the times, the difference really lies in the kind of mechanism they use, like if it's a thin spray or if it's drops or stuff like that. Medication-wise, they're the same. They work slowly but surely. So if you feel that you're having nasal congestion and you put those drops in, and now you're suddenly not still feeling better, you got to use them for a week, maybe two, and once a day or twice a day. And once you've gone through this and you've used it for a few days, it primes the lining of the nose, and then you actually start having less of the symptoms. And in a few days, your symptoms tend to resolve. Don't think that you use the nasal spray today and it didn't work, so it's useless, it's the wrong medicine. So be careful with that. But yes, that actually works and it helps, and that is what we prescribe and what we recommend for all our patients. And just be patient with that. Now, in combination with an Allegra or Zyrtec or Claritin, you can use the generics. I prefer buying the generics. They're cheaper and they work just as well. Some people tend to do better with one versus another. Feel free to try one if you feel that it's not really doing much for you. I have tried all of them with my patients. I have noticed that some people tend to do better with one versus the other, but they're really not. I don't really have preference for one over the other because it's people dependent. Some people just like Allegra more than Claritin, and the others can live without Claritin. And some people like the Zyrtex. So more or less the same. See what works for you. It's okay to switch and try another one, but take only whatever the package says. Don't exceed the dosing on those things, unless your doctor is recommending otherwise for you. Same thing with eye drops. Usually they are once a day or twice a day. Use them as prescribed. Keep away from the triggers, and that'll help. And now the only thing I'll add to that, the allergic conjunctivitis, is I have seen during this time a lot of dry eyes, because dry eyes is basically, your eyes are generally moist, and they make a little bit of tears, and then you blink your eyes and it makes more, and it keeps them lubricated, and it keeps doing that. But when you're watching TV, when you're watching or your TV screen, your computer screen, everybody is, or your iPhone screen, you tend to blink a little bit less. So you tend to blink a little bit less frequently, and as a result, the air outside tends to dry your eyes out. Now, if the air is very dry outside, that means the humidity is low. Naturally, by laws of physics, that air is trying to suck out moisture from everything that it can, including your eyes. So in low humidity, the air will try to pull out the moisture from your eyes, your nose and stuff. So you need to moisturize it more, spend less time in front of screens and stuff. And that the feeling that you get is tearing and burning sensation in your eyes. Your vision might not be as sharp, and I have the same symptoms too, because we're all living in the same world. I use certain moisturizing eye drops as frequently as I can, and it works great. I don't suffer from allergies as bad as maybe dry eyes, but once I start hydrating my eyes, symptoms go away, and then I'm more mindful of that. Other things besides the humidity, if the fan in your car, the air conditioning or the heat is running at high in your car, that thing will suck out the moisture from your eyes. At home, if you have fans running, or especially if it's a table fan that's blowing right into your face, and at that time you're trying to work on your computer or your iPhone, that's going to suck the air, the moisture out of your eyes. So be prepared to have some moisturizing eye drops, which are different from the allergy drops. And yes, you can use both of them, but just have them in your pocket and use them frequently. So those are your basic things. Identify. You should see a doctor if you're having a cough that's lasting a few more than a day or two, because you might be wheezing, and the treatment of that is not available over the counter, and it tends to get worse. So be careful with that. Other people, just to add a little to the seasonal asthma, we can talk about that another time, but seasonal asthma is one of the things that season changes. You're exposed to something, and mostly in the spring, then you have a flare-up. Other will have a cold-induced bronchospasm, which is again kind of seasonal. When the weather is getting colder, you breathe in cold air, and you start wheezing. Third is exercise-induced asthma, where everything is perfectly fine. You start exercising, you start running, you start working out, lifting weights, and now you can't breathe. You start creating bronchospasm, and bronchospasm is like you're having difficulty breathing air in. So again, anytime, go see your doctor. He or she will listen to your lungs, and if they're clear, for the most part, you'll be out of the woods. The rest can be managed. The rest of the symptoms are probably much more annoying, but this is more concerning from a health perspective, and because if you're not breathing well, it'll lead to multiple other issues. So we talked about the eye drops, nasal steroids, and systemic antihistamines, which are your Zyrtec and Claritin, Allegra, etc. I would say avoid the Allegra Ds, Claritin D, the decongestant aspect. If you have to use it, and if it works great for you, minimize the use, limit the use. Don't use it frequently, don't use it all the time, and use it only when you need it necessarily. But these will help you a lot. If you're coughing, see a doctor to make sure you're not wheezing. And sometimes people can tell when they're wheezing because it's that bad, but a lot of times they can't. I just saw a gentleman today who had the same situation where he was wheezing away. He does not have asthma or anything, and he said 3-4 days ago he was wheezing and he was coughing. It was miserable, but now he's feeling better. So that's not his concern. But I listened to his lungs, and I felt he was barely breathing, and so he was feeling better than how bad it was, but still dealing with that. So be aware of that. Something to keep in mind. Now, medications to be careful and to avoid are your first generation antihistamines, like Benadryl. It works great. We use it all the time, but it's a first generation anti-allergy medication. It makes you drowsy. It makes you very sleepy. People are using it as a sleep aid. They can't sleep, they take a Benadryl and it helps them fall asleep. But if you're trying to go to work, get something done, go through your daily activities, you're miserable with allergies, and you take a Benadryl, your whole day is still shot, because you're feeling better, but now you're feeling very sleepy all day. And if you take a nap during the day, then you're going to be up all night. So it causes issues that you don't want. And in older people, it can cause even more issues, because if you're older and you're sleepy, you can have falls. It can cause urinary retention. That means you're not peeing, not being able to pee properly, or pee enough. And in older people, that can cause to infections and yada yada yada. So just be careful. Like, if you're gonna take over the counter, just take the newer medications for a short time until you see a doctor, or until your symptoms resolve. If your symptoms are not going away in like a few days while you've done everything, then maybe you want to get checked out. I want to quickly touch base on the same concept of eczema and allergies, rashes and stuff. We're beginning to see a lot of that also because of the change, and 80% of that is due to the change in humidity around us. Dry air will suck out the moisture from your skin. Leave it dry. Dry skin itches. Simple. If your skin is dry, it's gonna itch, and the more you scratch it, you're taking away the top layer of the skin that is a protective layer, but your nails are like scratching that layer off. And when new skin is forming, it itches more. As you may have seen, if some of you ever had, sutures done, or like any injury, or you scratched something and then it was healing, the healing part, whenever the skin is healing, it starts itching. And now this is where you are scratching the top layer off, and now that's going to itch, but it was itching because it was dry. So that starts a cycle, a catch-22, and the more you damage your skin, the worse it's going to get, and the harder it's going to have, the harder time it's going to have to heal. The simplest measure for itchy skin is keeping it moisturized, and not further drying it out. So maintain good humidity. If you can't maintain better humidity, it is what it is, then use a lot of moisturizer. And do not use alcohol on it. Now that we're out of the COVID season, I don't recommend using hand sanitizers unless necessary. Hand sanitizers are great. They work just like they say, and they eliminate all the bugs on your hands. But they're alcohol based. Alcohol evaporates quickly and takes all the moisture with it. It dries out your skin like nobody's business. So all these hand sanitizers will give you enough dry skin. So when I use a hand sanitizer, I try to get my hands, I use a hand sanitizer, but immediately try to wash my hands as soon as I can. Not immediately, but as soon as I can, I'll try to wash my hands and then put some moisturizer on it. Moisturizer of choice, anything you want to use, whether you want to use Lubriderm, Aveeno, Gold Bond, pick the one that you like more. Which one suits you more? They're like $5-6 for a smaller tube. Try one. If you don't like it, try another one. Then try another one. Eventually, you'll find one that you actually like. I personally like Lubriderm. And that's just the right amount of moisturization, and it's not sticky. But you might like something else, go for it. One is not necessarily better than another. I have seen it. What's better is trying to avoid things that are making your skin dry in the first place. So keeping it moisturized, washing your hands with cleansers, not soaps. That can also make a big difference. Soaps are your second big enemy, but soaps, their job is to wash away the oils. So they're very alkaline, and they wash away the skin oils, natural, that your body has. So it leaves it very bare, and leaves a dry skin. So yes, we can use a lot of moisturizers, but if your soaps are better, you're using the right soaps, you will cause less damage to your skin. Third, during such time when you're having itchy skin, you're dealing with this, try to reduce the time you spend in the shower. Because water, and especially hot water, you're basically washing away the top layer of oils the longer you stay there, and hot water is not that great for the skin for prolonged periods. Yeah, a quick hot shower, sure. Spending 30 minutes under a hot shower, you're going to get a rash. So you want to be careful, like take cool or lukewarm showers, keep them short, and that will help you with all these. And then after that, if the humidity in your house is on the lower side, you can simply adjust to that. You can buy those humidity checkers on Amazon for like $5, $10. They are actually very useful. They help you understand where things are, and so you can apply the appropriate remedy rather than going crazy with very expensive TV ads that are recommending different things. So obviously, if your skin has reached the point where it's not getting better with just moisturizer and it's itchy every night, and sometimes you can't avoid it, cut your nails. So if you have to scratch, you'll be scratching with your fingertips, not the nails. These are very practical things that actually do work. But if it's gotten to a point that, okay, my skin is like, my doctor said this is eczema, it's gotten worse, and nothing makes it better, so you want to go see a doctor, and the doctor is probably going to give you some creams to apply, creams or gels. But if you are using the right kind of soap, the right temperature of the water, the right duration in that hot water, and adjusting the humidity around the house, using regular moisturizers, that will make a big difference to allowing the creams that the doctors will prescribe, because they will actually get a chance to work. Because the steroids, creams, or now there are different other classes of drugs, but they're trying to heal your skin, and then you are that medicine gets short time to work, but then you have had enough chance to wash it with the wrong soaps, and then you stay under water a long time and keep scratching it, and then you undo the good that these medications are doing, and then suddenly 2 weeks later you're like, oh well, that medicine did not work. Well, actually, it has to work under the right circumstances. Not every medicine is going to work like magic. Send me any questions that you might have. Share it with friends and family if they want to join us on these talks. I know a lot of you get to watch it on the following day or whenever you get time. Just shoot me questions if you want me to talk about something. And I've been getting a lot of positive feedback, which is very encouraging for me to take time out and make sure I talk about this and help educate people around me, because to me a lot of this seems obvious, but it's not obvious or simple to everybody. So I'm more than happy to share. And yes, do these things work or not? I see enough patients every day that usually I will try to avoid giving advice on what doesn't seem to work. And it's not just straight from the books, it's a lot of experience, what's working, what's not working. But a lot of times just a little self-awareness, some knowledge will help you make the right decisions. Come to the doctor when you need to, and sometimes it'll keep you from panicking that maybe you don't need to see doctor tonight or tomorrow morning. It can wait. You can, but you need a little bit more understanding of the condition, because sometimes you can make the wrong decision, and that's not that great either. So that's all I have for today. And again, as always, please get me your questions. Give me some feedback. What would you like me to do better? What should I talk about? But this honestly is a lot of fun for me, and if it can help you guys or any of your friends and family in any way, then the job is done. Thank you very much. I will see you in 2 weeks. Thank you. Bye-bye.